medication overuse headache is a dynamic disease that evolves over time, typically over years, in patients with a pre-existing headache condition with an episodic pattern. Individuals receive a diagnosis of MOH along with the pre-existing headache diagnosis, which will be in most cases migraine, less frequently tension-type headache, and occasionally other headache types. The chain of events includes a worsening of frequency or severity of the primary headache attacks over months, paralleled by progressively increased use of acute medications, until the threshold for chronicity, which is set as at least 15 headache days per month, and the days of acute medication use is reached and maintained for at least 3 months. The diagnosis of MOH, therefore, requires a careful history. A thorough examination is also necessary to exclude red flags, since multiple concurrent diseases may negatively affect the course of a pre-existing primary headache and prompt an increased use of acute medications. In the presence of any red flags, targeted diagnostic evaluation with blood tests, neuroimaging, or even cerebrospinal fluid testing may be required. Another tool, extremely important of course, for diagnosing medication overuse headache is the headache diary or calendar, where the patient has to input the headache days and the days of acute medications. The diagnostic criteria of the International Classification of Headache Disorders for medication overuse headache, which are shown here, are very simple and almost purely mathematical in their application. The classification identifies multiple subtypes of medication overuse: simple analgesics, ergotamine, triptans, opioids, or their combinations. The threshold for monthly days of use is set at 15 days per month for simple analgesics, while it is lowered to 10 days for the other classes. The diagnostic criteria, very importantly, do not consider the medication dosage per day, as at the moment reliable evidence is lacking in this regard. Now, the MOH criteria have an inner limitation, as they do not specifically mention the concept of temporal correlation between the increased use of acute medications and the worsening of headache frequency. While this correlation almost totally relies on patients' recall with the attached bias, it should always be searched by the clinician with an accurate history taking and possibly through other health records. This will further confirm the diagnosis and inform the treatment approach, which first and main step is patient's education about the offending action of overused acute medications.